Good morning and welcome to the Megacast. What's a Megacast after all? I've heard of a broadcast, a radio broadcast, and certainly know what a television show looks like, and got a pretty good idea what a podcast is. What the heck is a Megacast? Well, we will solve that mystery right out of the box today. The Megacast is radio, cable television, live streaming, Facebook Live, all bottled together to help us reach a large audience in Oakland County and maybe a little bit beyond, so we can share with you the coronavirus news of the day and all the information. Good morning and thank you for joining us. Dave Scott in our coronavirus studios at 89.3 Lakes FM in West Bloomfield and Civic Center TV. We are here under the fine work and auspices of the Greater West Bloomfield Cable Communications Commission, who makes us happen each and every day. But hey, wait a minute, there's a lot more. A big team of people coming together as we have pivoted our broadcast. You got to pivot now, right? So we pivoted our broadcast, and it includes not only the West Bloomfield Television Group, but folks in Birmingham. Thank you this morning to Birmingham Area Municipal Access TV in Birmingham, Bingham Farms, Beverly Hills, and Franklin. You'll find us in Channel 15 on Comcast and Channel 99 on AT&T. And then how about these great radio stations? 89.3 Lakes FM in West Bloomfield, Orchard Lake, Farmington Hills, Commerce Township, and beyond. 88.1 WBFH The Biff, broadcasting from Bloomfield Hills High School with a fantastic signal covering all the Woodward Corridor up through Keego Harbor and Sylvan and Pontiac. Thank you for tuning in there. And, of course, WAHS 89.5, Avondale Community Radio, broadcasting from Avondale High School on 89.5 FM and putting a great signal into Troy and Birmingham and all the northern Oakland County communities, as well as a big chunk of Macomb County. So thank you very much for joining us wherever you happen to be this morning. Again, we are here each and every day to do our very best to bring you the most up-to-date information that affects you during this coronavirus crisis as we all fight COVID-19. I'm Dave Scott. Tyler Keefe is making his way into the studio. He's got, like every millennial, he spends his entire life on his cell phone, but I know he's going to jump in and join us. I pre-cleaned the studio before you got here. We're down to our very last Clorox disinfectant wipe. So, in fact, maybe we can send Erica Jones, who's out of the field right now, heading off to Starbucks to let us know what the carry-out coffee situation looks like today. Maybe she can give us an update and how that's going and find us some more wipes somewhere out there. But we're all clean and ready to go. We're keeping our social distance here. As you go to work, we advise you to do the same thing. We're not doing the masks in the studio, but we are around the rest of the building, and we're keeping our 6 feet here, so it works out pretty well. Show-wise today, we have Rob Fowler joining us, CEO of the Small Business Association of Michigan. They're known as SBAM, and there is no bigger and more influential group here in the state of Michigan that deals with the small businesses that are most affected. And a lot of these businesses, Tyler, you might call small, are really not very small at all. These are businesses with 500 and sometimes even more employees. They're the restaurants, the movie theaters in some cases, the grocery stores, the car washes, the places you go every day for most of your consumer activities. What's going on? Where are we? What are their expectations as we go through the next couple of weeks here in Michigan? Rob Fowler, really interesting guy. We'll look forward to talking to him. We're going to check in with our physician on the show. Dr. Jamie Taweel joins us later on. Many patients showing up at primary care and other doctors' offices. Is that the right thing to do now? Where are we? Testing is seemingly... We are in much, much, much better shape from a testing standpoint, and we'll talk to him about that coming up in the next little bit. Jeremy Brown checks in later on, the manager of the Oakland County Farmers Market. Okay, that'll be fun. Suzanne Levine from the West Bloomfield Chamber, and Deborah Spencer, Director of Clinical Operations at Henry Ford Hospital, checking in. So those are some of our guests. Tyler, awful lot going on the news front today. We heard from Oakland University not too long ago that they are ready and have a plan together for students coming in. But now we've heard from Ferris and Central Michigan, and I'm sure we'll hear from our other universities around the state. They say that not only they have a plan, but they are looking forward to students coming back in the fall on campus.
There's been plenty of time in seeing these other universities and colleges and other educational institutions institute their own plans and come up with their own ideas has certainly helped these larger universities in the state of Michigan like Central Michigan and Ferris State and so on make their own plans. And if they can get students on campus in the fall, that would be fantastic.
Yeah, see, I don't know how they can say today, though. I mean, in all honesty, I hope it works out, but hope is not a plan. I mean, they got the hope thing going. I'm not so sure they got the plan thing, but we're going to get a hold of the folks at Ferris and CMU and see how they can, look in their crystal ball to know what the fall's going to look like. And maybe they just said, heck with it. We have to have our plan, and we can't implement our plan at the last minute. It just can't be done. So, come hell or high water, we're going to go ahead, and if we have to change our plan, we change our plan. And so, but they are expecting students on campus in the fall under different circumstances, but they are expecting students on campus in the fall. By the way, Monday, I know we're going to talk to the Oakland University folks again, so we'll see if there's been any update there. And for you parents that are concerned about what the fall is going to look like for your graduating seniors and your students that are attending one of our fine institutions, we will do the best we can. We heard from Michigan State and Ann Arbor and the other, and Western and the others.
Not just yet. I think those will probably be oncoming in the next couple of weeks, especially after universities of somewhat similar student body size like Central Michigan are coming out with their own plans. I would guess that the other large universities in the state, the largest being Michigan and Michigan State, will have their plans pretty shortly.
Just a note for those of you that are watching us on TV, you might notice that Tyler and I have our jackets on. It's like 30 degrees out this morning, and it's cold in our building. So our building has a very interesting heating and cooling system. We call it George. And because George is a little temperamental, and George will go where George will go. And this morning, George didn't want to be warm. No, so just understand that's why we have our coats on, if you're wondering, and if you are watching. Let's see, what else is going on? So back to are they going to do it or aren't they going to do it department, which has been like the main theme of this show over the past several weeks. How about the big news today in the Free Press that the Archdiocese of Detroit is we're going back to church next week. So, Catholics in Metro Detroit are going back to church next week. At some of the churches, the rest, they say, will open up on the 28th. Now, I was trying to get more information before we came on the air about this. I read this story in the Free Press, and nowhere in the story, in the Free Press or any of the other news organizations I checked out, did it say under what authority from the governor they're opening up. So I don't know. And I try to get clarity. I'm sure we'll get clarity. Now, you've watched the governor's press conferences. Did she say something in the last press conference about churches and synagogues being able to open up, in the next week or so?
I'm not. She hasn't said anything specifically just yet, and I don't know that she may have that authority to do so because of the separation of church and state. That being said, if churches are reopening and the Archdiocese has announced that they will partially reopen, I think that's probably to test out, does this method that we have in place to maintain social distancing and keep everybody safe in the church, is that going to work?
Well, it's interesting because, we're seeing more entities that are just asserting their situation. We saw the restaurants come out and say, hey, here's what we're going to do at the end of the month. Okay, we're going to open up. We certainly saw the famous barber in Owasso just make his own declaration and do what he wanted. You get into that same kind of thing. Does the governor really have jurisdiction over the tribal casinos in the state of Michigan? Not really. They can do whatever they want. They say they're not going to open up until June. So maybe you can research this while we're on the air. If somebody knows, call us, let us know. But as of right now, at the time that we're doing this live broadcast, I just didn't see it reported. You would think if somebody's reporting that the churches are going to open up, right? Because it was such a big deal before that they would say under the governor's order and under this, that, and the other thing. So we might have missed that. But there doesn't seem to be any reference in any story or any hesitation about that. Governor did speak out about football. The governor did speak out about football. She said in an interview on the radio yesterday here in Detroit, not on our show, but on another show, she said that do not expect the stadium, Ford Field, and other stadiums to be full this fall. Sobering comment for football fans.
Absolutely. That doesn't eliminate the possibility of professional or other levels of sport being played in the fall, but but that declaration that the state will not allow possibly fans in these stadiums while these athletes are playing sports, that's huge for sports fans and just for the direction of where this response is going.
So these are all issues that, certainly are not right here in West Bloomfield, not right here in Troy, but they affect every single one of us. Are we going to go to football games? Are we going to be able to go to church? And for many people that live in our area and are listening right now, many people work for General Motors and the manufacturing side. So the initial phase of manufacturing opened on Monday here in the state of Michigan. We've talked to a number of manufacturers who've been doing a fantastic job getting their business open and following all the rules and the guidelines. And kudos to them, and kudos to the folks at Oakland County who have published an amazing set of information that if you're a business and you want to know what you need to do and all the rules and anything, you can go. Somebody texted me something about the church issue. We'll take a look at that in a minute. But you can go to the Oakland County website, linked right at Civic Center TV, and find out more information about that. But where I was going, Mary Barry yesterday, General Motors, says they will be in full. That's full production in 4 weeks. That's quite a statement. That was very interesting and encouraging to see that as well.
Yeah, it's an excellent turnaround. It's really, really swift turnaround as well. And I think that just goes to show, in some ways, how prepared the manufacturers, like we spoke earlier on this week with Chris Bernecki from IQ Manufacturing, said that his team had a full plan ready to go, and so that when the time was called that they're good to go and reopen, they could reopen. I would imagine it's the same situation for these larger manufacturers as well. And if they're able to have that quick of a turnaround, they're likely able to implement their plans right away and be able to make that work.
One of the other big stories really hits home with our team right here at Civic Center TV and Lakes FM, and that is testing. Testing is really starting to happen around our region. We've seen more and more reports, different entities. Remember, we talked to the folks at Telegraph Clinics. They have a number of clinics in our Oakland County service area, and they are doing testing. Dave Coulter was on, the Oakland County executive, a couple of days ago, said the testing is going really well. I saw a story. I can't remember the number, and I didn't write it down, Tyler, but I think it was like 14,000 tests happening every day in the state of Michigan. So we are making progress. What's it all like? How's it work? What's going to happen to you when you go get your test? Well, we could call a doctor or a nurse or somebody, but why not just go to the ultimate expert? It is the Zoom producer of the Megacast, Larry Nyland, checking in from home, and he got a test. So let's find out how it went. Hey, Larry, how you doing today?
Good. How are you? Yes, I am the ultimate expert on everything at this show. I appreciate that.
Well, you are an expert in the way we get information, because we don't necessarily, go to the main news sources. We just find out what's happening. So you went out, got a test. Tell us about it. Where'd you go? How did it all go?
I did. Well, the reason I went out for a test, I had not just been feeling great, just having some headaches, sore throat, things like that, and you think, well, it's probably not it, but I want to be more sure for, I help my mom out a lot, and she's elderly. She probably doesn't want me to reveal her age, but I'm more concerned about, passing it along to her than I am whether I had it or not. So we had on Tammy Miller from Telegraph Urgent Care on last week. And then after the show, I spoke to her and she said, yeah, just come on down. So I drove on down there. The location is over at Telegraph in Square Lake. And it was kind of interesting when you pull in off of Square Lake, it kind of sends you to the back. It's located in a strip mall. And it sends you to the back of the strip mall. And I see this line of about 8 or 9 cars. And I'm like, wow, I didn't expect it to be that crowded. And then as I kind of looked farther up the line, I realized that these people were all in line for the drive-thru at Tropical Smoothie Cafe. So I pulled around to the front of the building where they have a pop-up tent set up right in front of the Telegraph Urgent Care, and there was nobody there. So I called Tammy because she said she would come out and meet me out there. So she came out. You fill out some paperwork, just like a normal doctor's visit. And then they will give you 2 tests there. They will give you the swab test and the antibody test.
Okay.
So the antibody test, all it is they just prick your finger with kind of like diabetics would know that you just prick your finger with it. And then they run it inside and they test it. And they said they'd be back in 10 minutes. And that was just maybe I would say 5 minutes. They came back and they said that was negative. And then after that, they gave me that result and they said, okay, now here comes the swab test. And you're kind of fearing it a little bit. But what they tell you to lean your head back. I'm still in my car at this time. And you lean your head back and they tell you to open your mouth and say, ah. And then they just kind of shove the swab up there. And it really was not that unpleasant at all. I mean, it was over so quickly that, you barely notice.
Larry, I don't get too concerned when a doctor comes to me and says, just open your mouth and say, ah. When they say, turn your head and cough. That one gets a little bit. It's more of my. I'm sorry. Forgive me. So it wasn't that bad. So the swab, because everyone says the swab up your nose is really, really uncomfortable. Wasn't that bad?
Yeah. The gentleman that did it, he said that the swabs they're using now are different from the ones they were using to begin with, and that it's much quicker. And then he pulls it out, and you do see that they did get up there because it does have a little redness and blood and stuff on it. He said, okay, that's it. We just need to get the DNA. And so that test, they said, was going to take about 3 days because they do have to send it. But I would say it was just 2 days later, I received a phone call, and that was negative as well.
All right. So were you asymptomatic? Did you have any reason to think that you might have had the coronavirus?
I never have the fever. Like my temperature is always very low, but I was having headaches, and I'm never a headache person. So I was going through a series of headaches, coughing a little bit in the morning, and then just a sore throat I was having like for almost a week.
I would tell our audience that you are a resident hypochondriac, but that wouldn't be nice or fair. You are, I know. But even I, who let everything go, even I would have been going through the same thing. So I'm going to go get tested. Now let me ask you a question, Larry. Did you have to get a prescription or anything, or are they testing anybody who goes there?
Well, the 2 days before, I had received a prescription from my physician to get one, and that I could go. He gave me a list of places, but I could go anywhere I want. And so Tammy at Telegraph Urgent Care, she said, if you have a prescription, you don't need to have one of their physicians come out and give you a little exam. So I did not have to. But she said you can go there without a prescription. It's just going to be that their doctor from the urgent care is going to have to come out and talk to you, though.
So let me ask you a quick question, and we'll move on in a minute. Larry Nyland, the Zoom producer. We have many producers on the show. We have a social media producer, we have a guest producer, and we have a Zoom producer. It's just the way it is. Larry does a really good job making sure that all of our Zoom guests are well taken care of, tests their connection before the show, gets them on the air. So all these Zoom guests that you see, it's the amazing Larry Nyland working at home with his fearless cat at his house to make sure the Zooms happen. So thank you for that. But Larry, so you don't have and you have not had the coronavirus. I mean, what are your thoughts?
Well, my thoughts are, because they kind of, with both results, they're acting like it's good news, and you kind of wish you almost had the antibody.
Absolutely. I want to go get tested. I want to know that I was asymptomatic and that I had the antibodies. Absolutely.
Yeah, especially if you only have minor symptoms. You're like, if this is as bad as it is for me, I got off, easy, right. And then, hey, I can not worry about it for a while. But so I guess I'll be back to my hypochondriacal self for a while.
Well, I was thinking about reassigning you to some activities in the building, but it sounds like you're staying home for a while. Wow. But I mean, who knows? I mean, we all thought here, Tyler and I both suspected, especially myself, that I got it very early and had mild symptoms. So, man, we'll go get the test. But good experience, wasn't hard, didn't hurt. The nasal swab, they didn't, get brain cells when they pulled the thing down. It wasn't all that bad. And you had results in a couple of days. That's good news.
Yeah. I mean, it really was. It was very simple. So, I mean, if people are doing it out of not doing it out of any fear, that it's silly because it's really easy.
Did your insurance pay for it? Not that, money matters to a wealthy man such as yourself.
They did ask me for my insurance card, so I didn't pay anything out of pocket then. I mean, I'm thinking the insurance companies are supposed to pay for a standard test, but we'll see if I get it.
Well, keep an eye on that. Let me know. I think maybe we'll send a couple other folks over there too, and just see how we're doing. It's really cool. Again, we talked to Dave Coulter, Oakland County executive. He says you can go get your test for free. Okay, so you don't need to go somewhere like Telegraph Urgent Care or any of the other facilities. But, if you decide to go there, that's cool. And it sounds like you can get through. How long of a line was there? Was it long?
No, like I say, I'm in the back. The line for, if you wanted a smoothie, it would have taken you 10 to 15 minutes. There was no waiting at all for the coronavirus test.
See, I wasn't clear whether that was a situation or whether because of your esteemed status as the Zoom producer of the Megacast, if you got some special treatment of some kind.
No, I received no special. I would not have wanted special treatment. I'm people, Dave.
And you would have been in big trouble with the boss if you got special. We don't want to, we're not asking for anybody to do anything free for us. So, all right, well, good. Well, thank you. Thank you very much for the update. I appreciate it. Larry, we have about 3, 4, 5 minutes. I don't know if you can get Erica hooked up with us here, but Erica Jones, our ace reporter in the field, is running out to Starbucks because, Tyler, it's important to know if or not we can get a test, but coffee now. Coffee, we need to know if she's here already. Erica, can you hear me? Hello. Do we have to give her a couple of minutes? Can you hear me,
yes,
Erica?
Can you hear me?
I can. Where are you? What's going on?
So I'm right outside Starbucks on Orchard Lake Road, and they have a pretty good setup here. If you look at the door.
All right. She's going to flip her camera around, I think, and do some amazing stuff here. There we go. Okay, we can see it now. Yeah.
It says now open. Yeah, but they have these X's out here that people are standing on. So there was one girl, as you can see, someone just walked in, but there was one girl when I was here at first that was standing on this X for a while, and then one of the workers had to come out and grab her and let her in. So it seems very socially distanced out here as they anticipate more people to come. I don't know if I can even get inside.
Just go ahead and try. Just tell them you're live on Civic Center TV. Now, I know yesterday we didn't want to do that, but you could, Tyler, what do you think? We got a minute here? Yeah, okay. Yeah. Go ahead. We'll see what happens. See if your phone signal hangs in there. And just tell them you're live. We're just trying to find out what it's like so people know what it's like to come to Starbucks.
I'm live on Civic Center TV. We're a local TV station, and I'm just coming in to see what it's like, what you guys are doing for carry out now. Is that okay? Okay. Yeah. All right. Well, thank you so much.
Yeah, they didn't want to let you in. See, we shouldn't have told them. You should have just walked in with your.
Well, now it's very like when I walked in, they're not really letting anyone in. They have a table set up right there with people's drink orders just to pick up.
So the deal is, how's it work? You got to call your order in, and then you just come pick it up. So it's all curbside. You can't go into Starbucks.
Yeah, I mean, it says for mobile order pickup only. So yeah, you can't even go in the store. They weren't very happy to see me
walking in. So they did not let you in because you were live on television. They didn't let you in because they're not letting anybody in.
Oh no, it was because I was live on television. She said my manager is not here right now, I don't think
we can't have you media people just roaming in here. No. There's a coronavirus out there.
I still went in. So
all right.
Is it? But yeah, I mean. What?
Is it possible that you could get me a tall, dark roast? Tyler's laughing. You can't ask. Could you get us a couple of coffees and bring them back, and then we'll. It's really cold in the studio here, so if you would do that.
Text me. If someone texts me your orders, I will order them on my app.
Yeah, Tyler will do that. And again, for me, I would like just a grande dark roast with a bunch of cream here. All right?
All right.
And then whatever everybody else wants. So social distancing is working. Show us the sidewalk one more time. Starbucks has the sidewalk all set up, and you can go there. You can get your coffee. And this is one of the Starbucks that doesn't have any drive-through. I'm sure it's a little easier. The places.
Right, there's no drive-through.
Right, okay. All our Erica Jones in the field, keeping an eye on what's really going on with the coronavirus. Great report, Erica. Thank you very much, Tyler. I like these new reports.
I do too, and it was interesting to see her there and to see the process kind of work as we saw the person that did walk in to pick up their order. Usually that place around this time of day in West Bloomfield and other coffee locations throughout the greater Oakland County community are very packed around 9 o'clock, 10 o'clock in the morning as people are picking up their coffee and beginning their work day. And as you saw there, a little less foot traffic, a lot less foot traffic at this point in time, but people are still picking up their orders and coming in. And they have an interesting system that's working and protecting the safety there as well.
I will verify that some of the Starbucks that have the drive-through running are just amazingly busy. The Starbucks that I drive by, I drive by a bunch of them every day. The one in Troy, which is right at 15 Mile and Crooks. Oh my gosh. It's like, it's good that like all the other stores in the strip mall that's right there are closed because there's a huge line.
Oh, yeah.
I mean, all the way around, and they've got their employees. They've been doing the social distancing and having their place open for a while. They have a limited number of employees. You can't go in. You can only do the drive-through. But they've been giving out a lot of coffee. This is National Hospital Week, and I think yesterday or today was a National Nurses Day. So we salute all of our healthcare workers. And later on in the program, we're going to have an opportunity to talk to Deborah Spencer, the Director of Clinical Operations at Henry Ford Hospital, West Bloomfield. We look forward to chatting with her. Biggest headlines today in the program: the universities are saying they're going to, Ferris and CMU at least, are going to be welcoming students on campus. How it's all going to work, we are not clear, but we're going to have more information for you on that hopefully throughout the day. Public masses at our churches. The Archdiocese of Detroit says masses are going to begin early next week, and they're going to do it piecemeal, but beyond the end of the month, those will all be open. GM says full production in 4 weeks. Manufacturing is open again, full production in 4 weeks. And the governor says football with the NFL and the Lions this fall, maybe not. But if we are going to be going to the football games at Ford Field, it's going to be maybe 10, 15, 20,000 people. Do not expect capacity. And one other programming note, and then Rob Fowler is standing by from the Small Business Association of Michigan. We're going to get to him in just a second. So this big lawsuit that everyone's been talking about all across the media between the legislature and the governor that talks about the constitutionality of whether or not the governor can continue to impose these executive orders without the approval of the legislature. That goes to court on Friday. The first hearings are going to happen on Friday at 10 o'clock. And Tyler, I think it's going to be fascinating television. So we're going to get out of the way, and we'll bring that to you live on Friday unless something unusual happens. Is that all? Are we getting that all hooked up?
We'll get that in process. From what I've read from the courts, they are going to have a Zoom meeting that will be open to the media and the public for the verbal arguments, the oral arguments that will be held on Friday morning.
All right. Well, if they don't know exactly how to get that to work, they can call this guy, because Rob Fowler's Zoom meetings, they run just absolutely perfectly. Rob is the CEO of the Small Business Association of Michigan, and he joins us right now. Hey, Rob, how you doing today?
Hey, good, Dave. How you doing?
I'm doing good. So feeling pretty good. We're starting to see things open up a little bit. So one of our reporters is actually out at one of our Starbucks. It was closed until this week. So we're going to get some Starbucks coffee here in a couple of minutes. And, we're seeing some things open. Manufacturing seemed to open up this week. We're making progress. What do you have to report to us from the small business community in Michigan this week?
Yeah, Dave, thanks. We are trying to just simply monitor what's going on and make sure that our member small businesses across the state, and frankly, just all small businesses, sort of have the latest information. The way we've been talking about this is this new Michigan Safe Start plan. We've kind of moved from everybody has to stay home, but there are some exceptions to that, and we're moving towards everybody can be out except these kinds of people, mostly the vulnerable, and we're somewhere in the middle of that. And the Michigan Safe Start Plan is the guiding post for that. It has 6 phases. The final phase is back to completely normal. We are in phase 3. It's pretty prescriptive, and it also suggests there'll be some regionality about it. So there may be some parts of the state that will open up before other parts. But as an example, so in phase 3, manufacturing can start again. Construction can start again. Those two we've heard a lot about. But bars and restaurants aren't until phase 5. Retail comes on in full with some limitations in 4. So just to give you a sense of how this is likely to roll out, we think bars and restaurants will be the last to come back online. Bars and restaurants are probably also the most vulnerable to failure in this whole thing. Retail also, those are 2 industries just dominated by small companies. And I think what we're going to see is a number of them just simply aren't going to make it. They're telling us that. The new Harvard study just out says there'll be 100,000 small business failures across the nation. That probably is even low. So I think that's what we're looking at. I hope that's wrong. We're doing everything we can to help companies survive this thing, navigate the whole thing. But we did a survey. I think you covered a little bit. The survey suggested that there are about 14% of small businesses in our state who don't know whether they're going to make it through this thing. 4% are pretty sure they're not going to make it. And that's grim. That is, that's a big number.
And Rob Fowler, that is a survey of the perception of your membership, and if we're not careful, it could be worse than that. I don't wish that. I think it's going to be a lot better. I'm an eternal optimist, but that is a survey of the perception, and we don't really know. I mean, it's just complicated. As to how all this is opening up. What is interesting, and I would like your thoughts on, is that we're beginning to see organizations, associations, and entities assert themselves, even before the governor gets to a specific ruling. And I think of one of those organizations, the Michigan Restaurant Association. We had them on the air here last week. A lot of their members are members of yours. I know a lot of small businesses in the state of Michigan are restaurants and are part of the Small Business Association of Michigan as well. We talked to one restaurateur yesterday. Guy knows his way around Lansing, Marty Nolenberg, who's got a couple of restaurants right here in our backyard, and he's doing the best he can. But he echoed exactly what you said. Just not sure if they can make it, and there's certainly concern. If you're a restaurateur, you might sit there and scratch your head today and say, well, why do we got to wait till phase 5? So they're frustrated. Can you understand that frustration?
Well, absolutely. We're trying to channel that frustration without being, just belligerent about it. But we have, as an association of it, turned up the heat on our policymakers, the governor, and others, while remaining a part of the conversation. But to say, every day this goes on, more and more companies won't survive it. So you just have to know that is a fact. There are resources available. We've been helping our members and small businesses just understand what those resources are and guiding them to those. But there still are going to be a lot of them that aren't going to make it the longer this goes on. So the sort of unknowing is really difficult. What our members have been saying to us is, you tell me how long it's going to last, and I'll tell you if I can make it or not. But the not knowing how long it's going to last leaves a cloud of doubt, and uncertainty is really a killer in business. So I think the idea that we're going to come back phase at a time and a region at a time, while it's helpful, I guess, to understand how it's going to happen, when it's going to happen is the key question. And there is some suggestion that it may be well into June or July before restaurants and bars come back. Well, I think if that's the case, we really better be ready for, as a public, having way fewer options of places to go, as a business community, way fewer bars and restaurants, as as employees, way fewer places to go to work. That's just going to be the reality. So we, along with the Restaurant Association and others, are trying to be a balancing voice that says, okay, we can, if we wait until it's completely safe to go outside again, there'll be nothing to go outside to. And we have to have a balanced conversation about public policy here that says you actually can do both. You can be safe and go back to work. You can do both. It's not a trade-off between the two. As this policy debate has been so far, is if you want to open up the economy, you must be in favor of people dying, and that's simply not the choice. So we've been trying to be a voice of reason in this whole conversation, while some of our members are ready to just, storm the castle.
Yeah, no question about it. So, we could get into all the politics. And Rob, I congratulate you. You're doing such a good job of keeping your head. You and your association, the Small Business Association of Michigan, Rob Fowler, CEO. I wouldn't be as polite. I mean, it's a hard time right now. Are there sectors, we talked about the restaurants, maybe it's them. Are there sectors in the economy that you service through the Small Business Association of Michigan that you are particularly concerned about?
Well, the reason I talk about bars and restaurants is I think that's kind of the most vulnerable. I think retail is right there with them, small retail in particular. So the reality is during this period of time, your expenses don't entirely go away. You still have utilities, you still have a lease, you still have insurance and other expenses that haven't gone away on you. And so having no income while you still have those kind of expenses is just going to kill some businesses. That's just the reality. So the Paycheck Protection Program is a program that was developed by the Congress to give some real help, and we've been promoting it like crazy because we think it is legitimate, real help that may in fact save a number of businesses. Is one of the tools. The state has put some programs out, mostly some grant programs that the money's gone at this point, but and I think in the whole those things will help. But the reality is the longer it goes, the worse it's going to be. And I think the most vulnerable will tend to be those ones, honestly, who are going to be in the last phase, because it's where people congregate. If you have a meeting venue as a business, you're going to have some real trouble. Think about public meeting places, because I believe it's going to be well into the summer before we're able to have large meetings once again, concerts and ball games and large meetings. So if you're in the business of meetings, I think the world has changed really fundamentally.
Yeah, see, thanks a bunch. Rob knows what my day job is. But no, we know it. And there are people that are working on pivoting, and you've probably seen a million of these pivot stories, and these business people that have been able to pivot, they deserve so much credit because they are saving their business. They're providing us what we need right now, and they're saving their employees, and they're just helping out. I mean, if you're frustrated with what's going on, you can be frustrated, but get out and do something. And one of the antidotes to all this is pivot, right? So I know you probably got a ton of stories. We've had somebody on the show almost every day who is a hero in the pivoting arena. But you're right. I guess if we go back and talk about a sector, it's in trouble. It is the hotel and motel industry and the travel industry and up north. And, I saw an interesting story. I know you are a prolific observer of all political here in the state of Michigan, so you might read BridgeMI.com. I think it's a fantastic news organization. If you're not familiar with it, it's a very nonpartisan reporting, and they've got some fantastic reporters. And I was reading a story, we're going to try to get to it later on today, that they did trying to bust some of the myths and some of the statements that have been made by some folks on both sides of the aisle that weren't necessarily very accurate. And one of the things they highlighted was some of the reporting on the hospital occupancy and the available beds up in northern Michigan, which we've been told the hospitals are all at near peak, and that might not be entirely the story. Well, you're shaking your head, so I'll let people see that. It isn't the truth. It may be 50%, maybe less in some communities. So the governor's plan, which we've not seen this part of it implemented at all, does talk about some regionality and opening of some communities. Just seems to be an awful lot of hesitation, though, Rob Fowler, in that policy making it out to the state of Michigan.
Well, and this is that, I don't envy the governor or the president or anybody in in that kind of office where you've got to balance information coming at you from all different sides. And the public health voice has been very strong. And it is, we can't overwhelm our healthcare system. We can't overwhelm our hospitals. They have to have the capacity. We have to have enough personal protective equipment for our healthcare workers. Those are true limitations, but they're pretty much in hand today. And all across the state. In Southeast Michigan, they are under control. In West Michigan, which peaked a little bit later, they're under control. And in Northern Michigan, where they've never peaked at all, they're under control. So that, at some point, that's no longer a limitation, and the need to get the economy rolling again for everyone, for our employees, for our small businesses, is so compelling. And we have to get going again, and particularly in places where it is safe to do that. I am about to the point where I wonder what we're waiting on, because it seems like if the road map has been laid out, let's follow it. And what it lacks is dates. And so we're going to continue to press for balance, urgency, but to understand the consequences of waiting too long are pretty serious to our state's economy.
Well, I appreciate you saying that, and that message can't be told enough, as well as a story on the other side that if there are sides here, I don't think there are, but as well as a story that we have to make sure that we do not go down a path that is going to result in people getting sick again, because if that starts happening, then everyone is going to be in big trouble. We're going to have a real problem. I know we're doing great things here in Michigan to come up with treatments and come up with vaccines. We're contributing in Michigan, along with the rest of the world, to find those answers. But both of these things do need to be balanced. And Rob Fowler, CEO, Small Business Association of Michigan, I'm sure you're hearing the same thing that I'm hearing from businesses. The people that have not been able to open yet, they feel that some of the decisions are arbitrary, and giving the governor her due. She doesn't want to open everything at one time. I get that. But then you got to pick winners and losers, and it's really tough. And, the churches say, well, you can go to Walmart. Well, why can't I go to church? The restaurants and the bars are saying, well, you can go to Meijer. We can fix things so it's Meijer-like. And we got a cup of coffee from Starbucks. Thank God, on my studio desk this morning, we were able to get that. So darn it all, I'm sure there's a way that we can do this. I'm a little frustrated. There's no easy solution, but your members, do they feel they're being treated fair, and are they getting frustrated because there are some winners and losers in this whole process?
Well, sure. And I think early on it was even, it cut big versus small. That is, you could go into Meijer and buy, potting soil, but you couldn't go to a local nursery. So there was a little bit of that. But I also think the frustration I think a lot of members have today, a lot of small business owners, is we can be safe. We can have a safe workplace. We've recently issued a small business owner's guide to reopening safely, kind of a guidebook. CDC has rules, OSHA has rules, we can follow them, and following them in the workplace is what we've all embraced. I think people understand that you're going to have personal protective equipment, that 6 feet apart is going to be a rule of thumb for a while, no meetings in tight places. All those things I think people can get. And I think the frustration is we're ready to go under those circumstances and need a little bit of a green light. And frankly, Dave, I think one of the things we're seeing is a little bit of a slow roll. Some companies some businesses are just opening. And I think and I don't blame them. There's a little bit of, I'm going to die here, so arrest me if you need to, but I'm going to open my business, and I'm not sure that's advised or well advised. But I get the temptation to, just a little bit of civil disobedience across our state, and I think it could take off like wildfire. And I'm not so sure it's not beginning to happen right now.
Well, and we we all know it's happening, so there's no denying it. The poster child of anarchy here in the state of Michigan is a 77-year-old barber in Owasso, and it's such an interesting story in that, you've got the state versus the barber, I guess. The state can't really do anything if the local authorities won't enforce the rules. The county sheriff in Owasso won't enforce the rules. It's getting to the point now where the only way the state can shut that guy down is by taking his license away, which they're threatening to do. I'm sorry, I cannot remember a more fascinating time, and I say that with great reluctance because of all the suffering people are going through. But there it is, and then I was really curious, and I don't intend to ask you about this, just a comment. Maybe you know something that you could share. But the Archdiocese today comes out and says they're going to open up churches. And I've been trying to read all the orders from the governor, and I don't see where in any of the orders the governor says that churches can open back up. Now, I might have missed that one. But we're seeing, right, thanks, we're seeing organizations beginning to exert themselves, as you've just said, and it's totally understandable. And we talked to a lot of local cops in this show, and they don't seem all that excited about throwing people in jail because they open up their business.
Well, and I think you've seen county sheriffs all across the state and prosecutors who essentially stood down and to say, we don't believe that's our job. We don't have the manpower. We don't have the authority. These are not laws. This is an executive order. And so it is a fascinating time. And I agree with you that and I want to be clear, I'm not in any way suggesting people should just disobey the executive order. I'm saying it is happening, and I really think businesses should be careful about it. But it speaks to the pent-up feeling that I'm running out of options.
Yeah.
That, I think, is really what it says, is when you get to the point where you think, I've got nothing left to lose, take away my license, shut me down, I'm going anyway. That's kind of where we are, I think, in some cases.
Well, thanks for sharing all this with me. I know you're not telling people to go out and break the law, Rob Fowler. I know that, and I think just as a reminder to folks that are listening and watching, hopefully this is helpful. This discussion for you as you're trying to decide what to do in your business and how you're going to make all this happen. But even the Republicans in the legislature who are suing the governor, and we'll see all of them in court on Friday, even they are saying, don't, follow the rules, follow the law. For people that are going to protest in Lansing around, put your masks on, keep your social distance. You got to do what you got to do, but, just be careful, follow the rules. And, Rob, maybe we can end this on a positive note today, and that is, I'll tell you what, we see it every day. What this show does is goes to the front line and talks to people that are, we've taken our reporters and taken a phone and just tried to walk into a store and see what happens. Everyone's wearing masks. Everyone's keeping their social distancing. I continue to be amazed when I drive to the studio every day to see how few cars are still on the road as manufacturing and businesses are opening. I think we're doing really great, and the numbers are indicating that. So, that's, and even talking to Greg Flynn, our fire chief in West Bloomfield yesterday, he says the same thing. People are doing a great job making this happen, and I think as soon as we get these businesses open, it's better. And I think, Rob, that through your communications, I'm on your website right now reading the Small Business Guide and all the information. It's that information that folks like you are putting out, and your amazing membership and all of our neighbors who are making it happen. Your thoughts?
Well, I appreciate the compliment, Dave. You're a member of ours, and we appreciate that. And I think I think this is a time when associations, chambers of commerce, organizations like this, who are the voice of a segment of our economy, a sector of our economy, really need to stand up. And I think we've tried to do that. We've tried to fill the gap with information and advocacy. It's interesting to say go to our website is just kind of become a throwaway line, but in our case, every single day we're curating and updating that website. We have a staff of 26 who have completely pivoted towards helping small business navigate this issue. And so our entire focus right now is helping small businesses through this so that they can survive and Michigan can come back more quickly.
Well, your information is really helpful, and your information, we'll get more of it up online today on our website. And then I talked to some businesses on the air this week, some of the manufacturers that are opening up, and they go to information like yours and information from Oakland County, who's also done a really wonderful job taking all of the orders and giving businesses an idea how to get the forms together and what to tell their employees. All the information is out there. Okay, any of your small business owners who are having a hard time trying to figure it out, just go to the SBAM website, go to the Oakland County website, and you're going to find everything you need. Rob, thank you very much. I just feel better after I talk to you for a little while. So, and I'm sure your members do as well. Anything else you want to add? Any big news you want to break or anything today?
No big news. Dave, thanks for letting us come on, and appreciate what you're doing. And I think you have kind of understood this earthquake that's happening to your business. And I think a lot of business owners have to really kind of take it in at this point and say, what's going to be different in the future and what kind of opportunity is there in that change? And I love entrepreneurs. I love small businesses because I think they see those kinds of opportunities. They change quickly. And I have a lot of faith that small businesses will survive and thrive.
All right. Well, I do too. Thank you very much. And I got my coffee now. If I just get a haircut, everything would be a whole lot better. Thanks, Rob. I appreciate it. Good talking to you today.
Thanks, Dave.
All right. He is Rob Fowler, the CEO of the Small Business Association of Michigan, with some really good thoughts and very, very helpful information. Go to their website. If you're a business owner and you're trying to figure this out, go to their website. You're going to find a lot of really helpful information. So, Tyler, we've been talking about testing. Our own Larry Nyland was out getting tests earlier. We're going to check in with our local medical expert, Dr. Jamie Taweel. Joins us next. In fact, he's here already. We'll chime in with him in just a moment. He is going to talk about some of the health and medical issues. Jeremy Brown, manager of the Oakland County Farmers Market, will check in next hour. Suzanne Levine from the Greater West Bloomfield Chamber of Commerce is standing by. We're going to check in with her. And then Deborah Spencer, the Director of Clinical Operations at Henry Ford Hospital, West Bloomfield. They will all be here. So, and Tyler, you're hard at work at taking notes on everything and
I am
running all the buttons over there. Thank you very much. Don't touch your face, Dave. We're going to take a quick break, and we will be right back. The Megacast continues after this.
Hi, I'm Dr. Jonae Caldoon. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Welcome back. It is the Megacast right here on great radio and television outlets across Oakland County. I'm Dave Scott, Tyler Keefe. Over there on the other side of the studio, working hard, pressing all the buttons, making it happen, and keeping it all together. There's so many things to do behind the scenes. It looks like Tyler is just sitting over there doing nothing, But no, he's making it all happen, I'm telling you. Thank you for listening. You're the most important part of this whole broadcast. Tuning in on 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills, and WAHS Auburn Hills, 89.5 Avondale Community Radio. Thank you for watching on Birmingham Area Municipal Access Television, Channel 15 Comcast, in Birmingham, Bloomfield, Birmingham, Bingham Farms, Beverly Hills, and Franklin. And then Civic Center TV, Channel 15 in West Bloomfield, Orchard Lake, Eagle Harbor, and Sylvan Lake. You can watch us online. Easy way to do it is to go to civiccentertv.com, and you'll see us in full high definition. And then, are we on Facebook today, Tyler?
Yes, we're on the Facebook page of the Greater West Bloomfield Chamber of Commerce.
Oh, okay. Well, thank you, Suzanne, at the chamber,
yes.
and thank you for making all that happen. All right. So, this guy has been trying to run his practice and keep up my entire staff healthy and out of trouble, which is no easy task. So, Dr. Jamie Taweel joins us, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, welcome back to the Megacast.
Thank you for having me. How you doing?
Good, good. An extra, just quick thank you. Jeff, the producer of the show, had some terrible incident in his backyard. I told him to be careful and severely sprained his ankle. Is he doing okay? I know you've been talking to him. Thank you.
Seems to be doing okay. I think he's taking it easy for a little bit, and if it doesn't get any better, we're going to have to get a little bit more in depth as to what's going on exactly.
All right, well, we'll check in. We're going to, Jeff, I know you're listening, so at some point, maybe after this interview, we want to see that ankle on the broadcast today, make sure it's okay. I'm not going to make you do a diagnosis, Dr. Taweel, over Civic Center TV and all of our other television outlets, but we'll maybe want to make sure he's doing all right. And there's a pretty good example. I mean, some non-coronavirus incident happened. He picked up at first he just called me, and I said, well, I can't do anything for you. What, call Dr. Taweel. So he called your office, and you did some telemedicine, right? Is that what happened?
I believe so, yes.
Yeah, all right.
Just quick, got some photos. We're able to kind of do a cursory exam.
Yeah, so and then you talk to him, and if he needs to come in, you'll know in a couple of days, and if he's okay and he doesn't. Is that what's happening an awful lot? Are people, because some people are afraid to pick up the phone or come see you.
Understood. I think the big issue is that a lot of times, getting a telehealth call can really give me an idea of whether or not it's something that needs to be seen versus something that can wait a little bit longer. Do you know what I mean? Oftentimes when patients are really concerned, they tend to sit on things because they're afraid that if they don't see me or if they do a video call that, it's not going to get evaluated fully. But the reality of the situation is that when we do those video calls, we're able to at least discern whether or not it's a complete emergency versus something that, hey, you have a little bit of time. So if you do have some concerns regarding COVID, you can wait on it a little bit. And if you do wait, these are going to be the consequences of that.
Well, I'm really encouraged by the testing we're seeing. I don't know if you have time every day to go in and look at the Oakland County testing results, but at first it was really hard to decipher what was going on because we started doing a lot more testing. And then, of course, there's going to be a few more cases that would pop up. But overall, they are now publishing the percentage of positive cases that are happening. And we're seeing that number is pretty much under control. It's like in between 7 and 10% most days. Is that good, bad? Where are we? What do you think?
Obviously, you want to get it as good as possible, but it seems to be leveling off to a degree, and that's positive. So I think that the social distancing is working. We are flattening that curve. We're not reducing the amount of cases so much as we're just kind of spreading it out so that we can not overwhelm the system, if that makes any sense.
It makes perfect sense. And right now we are at a pivotal time, too. I know everyone's watching real close. Because we're opening businesses back up, right? So we really want to watch the numbers over the next couple of weeks, right?
Yeah, and it's excellent that we're able to get so much more testing because now we're able to isolate. We can really get people to sit these ones out instead of just saying, you know what, you have a couple of symptoms, the entire system is out. Now we're able to say, all right, you have this, you need to self-quarantine. We're able to kind of do this a little bit more focused as opposed to a shotgun approach, which I think is going to be much more beneficial for not only the economy, but also for everyone's health.
And we're beginning to see now that the contact tracing is beginning to pop up here in Michigan. Another big thing we said, we got to get the contact tracing, we got to get the testing to be able to open things back up. That's happening. A big contract given to one of Dan Gilbert's companies, and they got the big phone centers and all these people. Why not? Already set up for it. So the state is contracted with them to start doing contact tracing, and that should help as well. So those are the two things, right? Testing and contact tracing that the medical community wants to see, correct?
Absolutely. And I'm hoping that this will help kind of guide care a little bit better rather than allow people. The one thing I worry about is that people will get this false sense of security that, hey, we have it all under control and everybody just goes back to business as usual. I think they need to really just be concerned that there might be another wave coming through. They might need to kind of take this information that they receive and just be cautious with it. That's all.
Well,
but I am excited that things are starting to slowly roll back into play. And I'm glad that we have all of these things in place that we're able to really control this to a reasonable degree, where we're able to just get the information that we need to prevent this from becoming a complete disaster. So I'm optimistic. I'm very, they're going smoothly. I mean, we're doing a lot more testing specifically in my office. We're starting to see patients. And so things are really starting to kind of pick up. We're still doing telehealth for those that do have those concerns. And I encourage patients to not avoid getting things looked at either via telehealth or otherwise, as long, just because they're concerned they might catch COVID. The healthcare system is really working hard to mitigate any risks. So, don't want things to go unheeded.
No, and we're hearing that the hospitals and the medical facilities are doing a great job making sure that if you go in and you're going in for something other than COVID, that you're going to be safe. It's going to work out okay, and you're going to be fine. So, no, we want to encourage people to go in and get that treatment. And part of it too is just the survival of your industry. The docs are business people too. The hospitals, as everyone knows, losing a lot of money, haven't been able to do the elective procedures, and they're going to get some relief from the federal government, money coming, but it's smaller offices like yours really that have a greater challenge economically. You got to get up and running. How's that going in your office and your colleagues around Michigan?
I can't speak on the colleagues, but as far as just personal experience, my office, we've reopened. We're having limited appointments for kind of we're spacing things out because now our turnaround time has got to be a lot slower because we have to accommodate for the fact that we're completely sterilizing the room from top to bottom between each patient. And we had to reset up plans in place. You can't come into the building unless you are screened for COVID in terms of just a questionnaire. We take your temperature, and if it looks like you might have it, then I come out to the parking lot and I will do a nasal swab on the spot, send that out, and you have to self-quarantine until you get results. Otherwise, if you do pass and you come in, then you get put in a room and we get to do all of the fun stuff while we're still doing telehealth calls. So it's slowed us down considerably, and we're trying to slowly roll back in and get into this groove. But with the amount of things that we have to adhere to, it's definitely we're taking a hit.
Yeah, it just cracks me up. Drive-through medicine has come to Michigan, but no, you're not the only one to do it. It's cool. So you put your sneakers on and you're running around. You're probably getting all your steps in right now, Doc.
Exactly.
So that's good. So
in a few months back.
Yeah.
Our Larry Nyland, who you talk to before you come on the air every day, he's our Zoom producer. And Larry does a really good job taking care of his health and always on top of it. So he went out and he was tested, and I don't know if you talked to him about it before he came on, but Larry was tested, and he had the two tests. So it seems that's what's going on in a lot of places. He had the antibody test, that's the fingerprint prick test, and he had the nasal swab test to see if he had active coronavirus. Those, I assume, are the two big tests, correct?
Yes.
Okay. So he had both of those, and then Larry was disappointed because he came back negative on both of them. Seems like people are rooting to have the antibodies right now. Is that crazy or what?
It is a little bit. There's still, the jury's still out as far as whether or not you've had exposures to this, whether or not you still can't get it again. There's, it takes a little bit of time. There are still false negatives. I think the nasal swab has a 40% false negative rate, 30 to 40. The antibodies is still a little bit, has some false negatives, and it's also not 100% accurate in terms of this. And the timing of it becomes a bit of an issue. But, Larry should be relieved. He hasn't been exposed to it.
He should be. Larry is our resident hypochondriac. He admitted that himself on the air. So, well, you just made news again, and I'm sure other people have talked about it. I read as much as I can every day. I've not seen. I mean, I knew there were a lot of inaccurate tests, but I didn't know the number was quite as high as 30 or 40% on the nasal test. That's a big number.
The nasal, yeah, because a lot of it's also operator dependent. Are they able to get, I don't know if you've had that nasal swab. I'm sure Larry can tell you. They pretty much, it's almost like they're touching the back of your sinuses with that. It's not a comfortable test. It's not painful. It's just uncomfortable. It's an odd feeling. But it can be operator dependent, and they have to go in there and really kind of get that. It can be up to 30%. So, guidelines, at least from the infectious disease expert that I consult with, recommends even if you're symptomatic, regardless of a negative swab, you should consider that patient to be COVID positive. So if you're still having the fevers, the myalgias, the difficulty in breathing, the shortness of breath, the headaches, things like that, you consider COVID positive unless, until the symptoms are gone for a minimum of 72 hours.
Anything new on the treatment front? Obviously, the big news, I think, a week or two ago was remdesivir, and that is supposed to be helping a lot of folks. Anything new on the treatment side that you're aware of?
No, the remdesivir is starting to work a little. Those studies that are coming out are positive. So they're now giving amounts of remdesivir to local hospitals, is trying to ration it out as best as possible to, again, reduce the length, to kind of shorten that time that the patient's in the hospital, which is excellent for regards to resources, so that patients aren't going to be in the hospital for longer periods of time. The quicker you can get home from the hospital, the better you are for everything, including the system. And I think this curve is flattening so that the healthcare systems are no longer as overwhelmed. They're still taking their hits, but I think it's improving to a degree. I think we're now coming to a good point where we have very good plans in place. So businesses are starting to open slowly. And I was excited to be able to get my coffee. So
I know. Hey folks, take a look on TV. I got my Starbucks right here. So yes, we are moving on. I heard, I think Starbucks is giving out free coffee. I got to be careful what I said, because I said the wrong thing. Can I say this? Is this true? Is it true that they were?
I don't know.
Did you pay for your coffee, Doc?
Sure.
I'll just ask you that. Did you get a free coffee, or did you pay for it? You paid for it.
I paid for it, but I used the app before I even got there. I just, ran.
I heard they were at some point that Starbucks is handing out free coffees. I don't think they're doing that anymore. And I don't want to get on the air and say that, because I'm going to get in trouble and send 1 million people to Starbucks, and if they are like a first responder or something like that.
They were for a period of time, but at that time, none of them were open. I don't know about now. I know Big B is as well. Big B's been really good about giving, if you're a healthcare professional, they were doing that for a period of time as well.
Doctor, thank you very much for joining us on the show, as you have so many times. Thank you so much for your service to the community. If people are interested, because they've gotten to know you after a while, like we have now, they want to, maybe come out and have you become their doctor, what information can you share with us so people can find you?
All one word, grandrivermedical.com, as well as, can call my office, 248-264-6169. I sincerely appreciate you allowing me to say that. And thank you very much for having me on. As always, it's always a pleasure to talk with you guys.
Well, pleasure is all mine. Final question, any prescription for our listeners and viewers today? Any final tips and how they can avoid this whole mess?
They're doing great. I think they need to just continue with this. I feel like people are feeling that this is starting to ease up a little bit and their guard's kind of coming down. I would advise them to please keep the guard up. Please continue the social distancing. I'm not saying you need to stay in. I'm suggesting that you continue to wear the masks, but I do want to see people doing things. I do want to see people getting out, but just as long as they're adhering to rules and continuing this, I think we'll be just fine.
It was funny yesterday. So we had the fire chief of West Bloomfield on, and he pulled his mask down under his nose. The people are pulling their mask down. They're wearing the mask, but then it gets hot and uncomfortable because everyone's wearing them in the stores now. Then they pull their mask down and expose their nose. He gave it a term. It's called facial covering displacement. Not a no good. Don't do it. Not going to happen. That's not it. Then the mask doesn't work, right?
No, it doesn't work at all. You're basically
right.
not doing anything.
Might as well not even be word. Not even word. Do not get into facial covering displacement. That, Tyler, would be an FCD. That is no good.
Oh, yes,
right?
no.
Thanks, Doc. Appreciate it. Good talking to you. He is Dr. Jamie Taweel, and you can find him at Grand River Medical Associates. And even if that's not right in your neighborhood, it's worth a drive. He's a good guy. We're going to take a break. We'll be back in a moment. This is the Megacast. Thank you for joining us.
Hi, I'm Dr. Jonay Khaldun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
And welcome back. It's the Megacast on great radio stations and municipal television and internet outlets all across Oakland County. Hey, Dave Scott here. Thank you very much for joining us. Tyler Keith here as well. And I'm a mess today. Look at me, this is terrible. I got my jacket on, my collar's all needs to be ironed, my hair. Oh my goodness. Trying to look presentable here on television. I need a haircut. So bad, Tyler. This is terrible. So, all right.
So do I.
Sorry about the vanity, everybody. Thank you for joining us. If you are in the West Bloomfield area, you're listening on Lakes FM. If you're in the Bloomfield Hills, Bloomfield Township area, and points beyond, you're listening today on 88.1 WBFH. If you're in Macomb County and you're in Troy and you're in Auburn Hills and points beyond, you're listening on WAHS 89.5. Avondale Community Radio. Thank you for tuning in. Thanks for watching today and seeing us in all of our messy glory here in our studio. Hello, Birmingham. You're watching at Birmingham Area Municipal Access, West Bloomfield Civic Center TV, and of course, you can watch anywhere across our coverage area today in two places. On Facebook, go to the West Bloomfield Chamber of Commerce website. They've added us to their Facebook, not website, to their Facebook page, and civiccentertv.com, and we've got the live web stream there. So, hey, everybody, thank you for watching. Good to have you with us. So, we are doing all we can to keep you up to date on everything that is Oakland County. And we are delighted now, in just a moment, as soon as we get a couple of more buttons hit, we'll be checking with Jeremy Brown. He's a manager of the Oakland County Farmers Market and the assistant park supervisor of the Waterford Oaks County Park. We'll check in with him in a couple of moments. Suzanne Levine also checks in from the West Bloomfield Chamber, and Deborah Spencer, the director of clinical operations at Henry Ford Hospital. West Bloomfield will be here. Top news stories of the day today. Tyler Ferris and Central Michigan University say they are going to have students on campus this fall. There'll be social distancing. There'll be new rules, but they will have students on campus. What's going on with your alma mater? Have we heard from Michigan State yet?
I have not heard about anything from them regarding the fall semester. I'm sure that they're still working on plans for the fall to figure that out. And that these smaller universities and colleges throughout the state, their plans will certainly factor in to, I would believe, what Michigan State and what other universities like the University of Michigan may do going forward.
The Archdiocese of Detroit is announcing in the Free Press today that that you can come to Mass this weekend. I believe of the dates, and that all of the churches will open up around the 28th of May. So big news from them, and I know that will come as very welcome news to folks around the state of Michigan. Mary Barr coming out and saying General Motors will be at full production in 4 weeks. In 4 weeks from now. That's really good news, and they're ramping up. That's pretty quick considering all the supply chains and their just-in-time deliveries are. They need some time to get back into operation. There was some concern at one point. I was really worried, Tyler, that we were going to be impacted by the Mexican part suppliers here, and our Detroit auto manufacturers and domestic auto manufacturers wouldn't be able to get ramped up. So to hear that word from Mary Barra today, that is awful good news. Governor says, hey, we might have football in the fall, but it doesn't look like we're going to have a packed house at Ford Field. So, the Lions need everything they can going for them, including that home fan base. So, if you do end up going to a Lions game, you're going to need to be really loud this year, when the defense is on the field. What do you think? I know you and I went to a lot of football games over the last couple of years. I don't know what it's going to be like going to a game, an NFL game, and not have a sold-out crowd there at Ford Field.
It'll be odd, especially in places like Ford Field, where no matter how the team's doing, it's a pretty packed house, and to see people that are going to be 6 feet apart, it's going to be significantly less people in the stadium. I think about places that are usually booming, such as in the NBA. You think about if they come back and they have the playoffs, and you have Staples Center, what the Lakers doing as well as they're doing. That's usually a booming crowd. In places like you said, Ford Field, or like Comerica Park on opening day. What's that going to be like when baseball begins in July, as they're currently planning?
On the bright side of that whole subject, it will be nice, though, when you get a beer or a soft drink, you're not going to have to fight for one of those cup holders on the seat. You can use, you could probably get two, right? And, forgive me for being silly. You're not even going to engage me in that conversation, are you?
We can go into it.
No, it's all right. And then, of course, the big news in Lansing over the next couple of days is going to be just a couple of things. Another protest scheduled for tomorrow in Lansing. And Governor has been really upset this week. And you can understand, she's been getting death threats, okay? And it doesn't look good, and it isn't good when you get a bunch of people converging on the Capitol with guns. And I understand what's going on, but there's got to be a better way to get it done. So protest tomorrow will likely, all the good things that are happening here in Michigan will be, in the back seat, and in the front seat of the news media is going to be these folks in Michigan protesting in the Capitol and showing up with their guns and not social distancing, masks, and then, talk about all the threats and the governor. And, things are a lot better here in Michigan than that, and that's going to be the story. So we'll have to just deal with that over the next 24 hours. And then on Friday, really, I think a fascinating day in the history of our state of Michigan from a legal perspective, as the Michigan legislature starts to exert itself in this whole government, these government orders, and the governor's orders, the legislature says, are no longer legal. Her authority from the legislature has expired. She says she doesn't need authority from the legislature. Courts are going to decide. The case opens up on on Friday at 10 o'clock in the morning. And here, you can just hand that to me. Friday at 10 o'clock in the morning, and we're going to cover it live, right, Tyler?
Yes, we're going to do it as best as we can to get that live for you here on the station. It is being reported by the courts that they are going to have a Zoom meeting that will be open to the media, so we'll do our best to get involved in that.
All right. Well, it is cold in our studio, which is why Tyler and I have our coats on. I don't know what's going on with our heating and cooling system, but it sure is beautiful outside. And let's check in now via Zoom. We can see him right here. It is Jeremy Brown, the manager of the Oakland County Farmers Market and the assistant park supervisor, Waterford Oaks County Park. Mr. Brown, welcome to the Megacast.
Thank you so much for having me.
Hey, good job on the Zoom. You're doing a good job holding your camera, and you got the sign right behind you and everything. You're looking great on
logo on my shirt.
Yeah, you did well. Nice job. if things don't go well over there at Parks, if you need a side gig, we can be a reporter here for Civic Center TV.
Yeah, well, my wife could always use the extra income. So,
yeah, sure. So let's talk about the farmers market. For people that are not aware of the farmers market, what it is, can you start there and then just feel free to segue right into what's going on during the coronavirus?
Sure. So the Oakland County Farmers Market, we are here in Waterford at 2350 Pontiac Lake Road. Our market has been around since 1922. We are open on Tuesdays, Thursdays, and Saturday from 7 a.m. to 1:30 p.m. And then also due to the coronavirus and the need to try and lessen the crowd on Saturday, we have started a Sunday market as well. And that runs from 8 a.m. till noon. And we'll run that at least through June, and we'll assess the situation as we go. So due to the coronavirus, we've had to make some operational changes. And that is, well, the governor's order allows us to sell food, any food products, so produce, baked goods, pastas, all of that good stuff. So any food product, we can sell agricultural products. So we have all the plants, the vegetable starters, the flowers, the hanging baskets, all of that good stuff. And then also we can sell personal hygiene products. So we have the soap lady, as we affectionately call her here. So you can buy things of that nature. What we cannot have is no crafters. So you're going to come to the market. You're not going to see the metal workers or the glass workers or the photographers. So we're really essential products only. We do have a barbecue vendor on site, Redwood Grill. Generally on a normal year, we would have picnic tables out and benches, and you could sit down and have breakfast or lunch. Unfortunately, we cannot do that. It is carry out only. Also, we've had to eliminate a lot of our programming, our special events and our educational programming. We've worked really hard over the last 10 years. Parks and Rec assumed management 10 years ago, and we've really worked hard to do all of these things, provide an educational experience, a special event, come and have lunch. But we're kind of going back to the old days of get the people in and get them out. You're going to be able to come and find lots of great stuff. But we do ask that you come in, or inside the building, you must wear your mask. We strongly encourage it on the outside. We have also created lots of space between the vendors, so that it makes for, extra space for movement of the guests. We'll also have our social distancing stickers and signage everywhere. We have had a lovely lady making masks every week, so that if you do come, and you don't have a mask to come in the building, we've been able to provide those, but that's going to be on a limited basis. So if you do come and we have run out, I apologize. But so we've done that. We've created one-way aisles underneath the canopy. We've created one-way aisles inside the building. Restrooms are one person at a time. Just really lots of hand sanitizing stations around too. We've added an extra porta-john outside. Just really, creating a little more elbow room for everybody.
Sure.
Again, we're open Tuesday, Thursday, and Saturday, and now the Sunday market. I would encourage you to come on a non-Saturday. Saturday's the big day. We have the most vendors, but that means we have the biggest crowd. And we really want to limit that crowd. And by a big crowd, historically, starting in May all the way up until June, we see anywhere from 3,000 to 5,000 people in a 6-hour window on Saturdays. So you can imagine socially distancing can be tough. So I would encourage you to come on the off days. Tuesdays is a good day. Thursday's really good. Sunday, we're just starting. So we're starting to get vendors for that. But again, if you must come on a Saturday, I would encourage you to come early, before 8 a.m. or after 11 a.m. Because really that 8 to 11 is the super busy time. And, we want to try and limit that. So, what are we going to do when the crowd gets too big on Saturday? Well, what we've done is we do have Oakland County deputies stationed at the entrance. And once we get to a certain capacity, we will block off the traffic until it settles down. It's not ideal, but these are things that we need to do to keep people safe. We want people to have a good experience, and our vendors understand that this is a new reality. Hopefully, it's not too long, but these are steps we have to take in order to keep people safe, and hopefully, before too long, we're back to normal.
Well, Jeremy Brown, that was great. You're doing a great job letting everybody know what's going on. Jeremy Brown is the manager of the Oakland County Farmers Market and the assistant park supervisor at Waterford Oaks County Park. And we're really glad to have you in the Megacast here and talk to folks all around Oakland County. It's fun to go to the farmers market. A lot of us go there for fun, but I think it's even better now. First of all, how cool. I mean, you can get out and get out to a farmers market. It might even be based on what you told me, it sounds like it's even safer than going to my grocery store, and they've been doing a really good job there too. But, when I think about a farmers market, I think about the farmers, duh. And so I start thinking about the supply chain. And it's a lot more direct at a farmer's market. It's farmer to farmer's market. And we've had a lot of trouble with the supply chain. Are you seeing folks that are bringing their products directly to you that you might not have seen in the past that are taking advantage of the simplicity of the farmer's market scenario?
Well, being that the market has such a long history, I have nearly 90 vendors that use this market, and about half of those, maybe 40 or so, are farmers. And we also consider the growers as farmers as well. So it's early in the season, so you're going to see the asparagus, the strawberries will be coming soon. Lots of mixed greens, microgreens. So you will see that produce. We also have a vendor, Penzine's Produce. Normally we're a producer only market during the main season. So that means the products must be grown by the vendor. But for at least May, possibly into June, we are allowing Brian Penzine to bring in outside products. So products that he hasn't grown himself. And we're doing that because people do want a safer experience coming to the farmer's market. So we are allowing that for a bit. So you will find produce here. You will still find a lot of farmers that are growing their own produce that they bring to the market. There's all the vegetable starter plants are here now. So, getting out and working in your garden is awesome during these times. Well, anytime it's awesome. But, all the hanging baskets are here, the succulents, the bedding plants. I mean, just really a wide variety. But additionally, we also have meat vendors. We'll have 3 meat vendors here this weekend, providing beef, pork, chicken. There is some lamb. It all depends on what their availability is. But yes, I have been getting quite a few emails from other farmers that are looking to participate, and we're going to do our best to accommodate them. Saturday's pretty full already, so I would definitely steer them to the Tuesdays and Thursdays and the new Sunday market. Even though there's a lot of things we can't do this year, the foundation of the market is still here, being the farmers and the growers. You're still going to be able to come out and talk to the farmers directly, ask them questions. And the quality of the products are just really superior, in my opinion.
Well, absolutely. And that's why we love going to the farmers markets. We love the experience. We enjoy the whole opportunity, and it works out really, really well. Jerry Brown is with us, manager of the Oakland County Farmers Market. And I didn't really think about this. I was so glad that our producers booked you today because, through the whole thing, I'm thinking like Kroger, and the other stores. And I just assumed you guys couldn't operate right now. So thank you very much. It sounds like, Jerry, you've really done a great job pivoting, figuring out how to make it work and make people happy, and obviously so much so that some people thrive in these tough times. It kind of sounds like that's what's going on at the farmers market in Oakland County. You're open on Sunday now where you weren't before, so that's awesome. Wednesday, I'm going to come by Sunday. When's the best time to come by on Sunday?
I'd say anytime, 8 a.m. to noon.
All right.
It's primarily going to be the flowers. The produce is going to be the Tuesday, Thursday, and Saturday.
And it's a really good idea that you've added the meat vendors as well, because we know that there is a shortage of meat nationwide. Have your farmers and vendors and the folks that you've had been able to get all the supplies that they need? And are people, when they come to the Oakland County Farmers Market, are they seeing the same kind of abundance and variety of products as they had in the past?
They are, absolutely. Keep in mind, all of our farmers, they, spent all winter preparing without, thinking that we would have a global pandemic. So they absolutely have everything that you would expect to find. It's just, we're doing our best. But yeah, you're going to find everything other than the crafters that were here before. You're still going to find all the produce that they have available, all the plants, honey, eggs. It's, I always encourage you to come because you never know what you're going to find. There's always something new.
Jeremy, I'm getting hungry just talking to you right now. So I'll definitely come by on Sunday. And I'm glad you mentioned soap because I'm out of soap right now. I mean, I've never used so much soap in my life. Tyler, washing my hands the right way has really made a big difference. I'm just ripping through the soap.
Oh, so am I. I've been friends through so much soap.
All right, silly guy.
We normally would have a health and nutrition educator here.
Yeah.
And, about singing your ABCs, while you're washing your hands.
Exactly. That's what we got to do right now.
This was all coming out. I sent her a text message, starting out the ABCs on it, and she thought that was fantastic. So,
Jeremy, we got to scoot along. Before we go, just can you talk a little bit about what's going on in the Oakland County parks in general? I know you know that story as well. So, what's open, what's not open, what can people expect?
So, Oakland County Parks, we have 14 parks. We have nearly 80 miles of trails and nearly 7,000 acres for you to enjoy. Currently, the Parks Commission has suspended the park entry fee at least through June 1st. We feel that, with everybody being cooped up and looking for opportunities to get out, it's something that we could do to help people come out and enjoy the parks. Unfortunately, our nature centers are closed. The restrooms are closed, but we do have porta-johns available. If you are wondering where our parks are located, go to oaklandcountyparks.com, and there's going to be a very comprehensive list of all the parks and the different types of trails. There's fishing going on. We're still open. We are still open, albeit at a limited capacity. The parks are here, and we've got a lot of great Oakland County parks.
You bet. And the golf courses, the Oakland County public golf courses too, that the county operates. I know they're open. I've seen them open.
They are absolutely. I believe, forgive me if I don't know all the details of the golf course operations, but I believe you do need to call them to make your tee time and pay over the phone. It's my understanding carts are available now. The golf courses are open. We're opening things as we can and in the safest manner that we can. Because at the end of the day, if people don't feel comfortable coming out, we haven't done our job. And, we're really taking this very seriously, and we're keeping your health and safety at the top of our thoughts.
Well, we get that. To that point, Jeremy Brown, just a final question. What are your numbers like for the farmers market? Are people coming? I mean, you're open on Sunday. They must be coming out, so I assume that's working.
So I always quote Saturdays, Generally, the first week in May, last year it was 2,300 people showed up. We have car counters. The first Saturday in May this year was 2,000 people. So it was really strong. And then those numbers will go up. Again, by the end of May, early June, the farmers market would generally see about 4,500 people. Hopefully we get there. Hopefully we'll be able to social distance, but people are coming out. They've been chomping at the bit to come out to the farmers market.
Well, last week they had to put their long johns and snow boots on to come out. It was so cold. So it'll be a lot nicer this weekend, and it's a beautiful day. Get out to the Oakland County parks. Get out and see Jeremy Brown. Get out to the Oakland County Farmers Market. One more time, you said it was. Give me the days again. I didn't write it down.
We're Tuesdays, Thursdays, and Saturdays from 7 a.m. 1:30 p.m. and then the new Sunday market from 8 a.m. to noon.
Jeremy, thanks for all your hard work on all of our behalf. Have a fantastic day, and thanks for joining us on the Megacast.
Thank you so much for your time.
All right, Tyler, there is a guy who loves his job.
Yes.
I'm telling you, Jeremy's fantastic. I'm glad we met him. So we're going to take a break. We'll be back in a couple of moments. Suzanne Levine checks in. She's the executive director of the Greater West Bloomfield Chamber of Commerce, and they have a program called Unsung Heroes. We'll find out who their unsung hero is, and then we are going to move over to the Henry Ford Hospital and talk to Deborah Spencer, the director of clinical operations. So that and more coming up. It is the Megacast. We'll be right back.
Disease Control in Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Keeping you connected in West Bloomfield during the coronavirus outbreak, 89.3 Lakes FM.
Didn't mean to hit that button, but that's okay. Thank you, Tyler. And also 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio, Civic Center TV, Birmingham Area Municipal Access Television, CivicCenterTV.com. Oh, it's exhausting just talking about all these outlets we have. And the very best of all today has got to be the West Bloomfield Chamber of Commerce Facebook page, operated solely and exclusively by Ms. Suzanne Levine, our good friend over at the Chamber. I was going to say your title. I always get your title wrong at the Chamber. It's
Executive Director.
See, I should know that. Executive
Director. It sounds
Director.
impressive, doesn't it? It sounds so impressive.
It is very impressive. Suzanne, thank you for joining us today on the Megacast. Thank you for having our signal on your Facebook Live. So, how the businesses in West Bloomfield doing? What are you hearing from them?
Well, I reached out to almost every single business that I was able to contact in our chamber. And, they're concerned because they're trying to reconfigure how they're going to do business in the future. And we're trying to strategize with them to help them understand that there are ways, whether it's curbside delivery, whether it's home delivery, putting their wares on YouTube. And so we're trying to help them with that. We have a couple webinars scheduled, Zoom meetings. So whatever we can do to try to, help them navigate these very challenging times, we're happy to do.
So they seem to be, by all of our, I don't know what I'm trying to say, Suzanne. This will come out. The businesses seem to be doing just fine. Those businesses that are open they seem to be doing fine. I mean, it's tough, but so many of them have pivoted and figured out how to make things work. Our Erica Jones is here in the studio with us. We can see her right over there, hard at work. Was just out at Starbucks in West Bloomfield. They hadn't been open. They got everything all marked off on the sidewalk, and we got the social distancing working. So, it's been almost 2 months now. Businesses those that are able to be open have figured out how to get through and at least do what they can.
Right. I think that the biggest concern is for the hair and nail salons. And they say that that's a stage, I think Whitmer said it's like phase 5 and we're in 3. So a lot of them are wondering how they're going to hang on till maybe July or August when they're able to reopen under very strict guidelines, because if they can only have 10 or 15 people in the entire salon at one time, where's the receptionist, where is, the stylist, where, how's that going to work? So they're going to have the biggest challenge of all.
Yeah, restaurants, the salons, right. The hotels. And, I look at me. I look terrible. I need a haircut so bad. So, no, I get it. It is really unfortunate. And I know personally all these business owners, and we all hate to see a business fail anywhere. So hopefully things are going to continue to do well on the health side of things, and we get these businesses open before long. And it'd be terrible if the salons aren't open till mid-July. I mean, I can't imagine
I
those
think
businesses can make
women
it.
will riot. Women will riot. I can tell you. There's going to be quite a women's movement to get some of them open under safe conditions. I know there are some salons that are selling the hair dye and some other products, curbside to try to, help their clients along. It's been very difficult for them.
Yeah, you were worried, so you opened the door, so now I can make this silly remark. You were worried about people toting guns in Lansing, Governor. How about 1,000 women with bad hair?
Right.
All right.
Yeah, I don't see that her hair's so bad. Just saying.
All right.
Not sure what's going on there, but.
All right. Well, you listen. Her job is not easy. We can joke around, but her job is not easy right now either. But we got to get these businesses open too. Right. So you have a program called Unsung Heroes. Why don't you tell us about it?
Well, this idea was born out of something that I was trying to figure out how to recognize people in our community that. It's not that they have a thankless job, but they do their job every day. They're putting themselves and their family at risk. And how could the chamber do something to acknowledge their effort? So I created this unsung hero, and thanks to Vito Kukuro, who's our social media expert, he created a logo. And then I started asking the community to make some nominations. It could be, someone in your neighborhood, a teenager that gets groceries, obviously the medical professional, but maybe there's some other people that we don't know about, that the grocery clerk, or maybe it's a restaurant worker. So it's been really wonderful to acknowledge them. They get e-blasts. I think there's going to be an article in West Bloomfield today that's going to, discuss some of these people. And I try to create my own little gift basket for them out of what's left of my dwindling supply, since I can't go out and shop. But it's amazing how much they appreciate any little acknowledgement of what they're doing. And it's such a good feeling to know that the community is, recognizing their effort.
Absolutely. Well, it never hurts to recognize people that are making a difference. I applaud you for doing that. Any recent recipients or anyone you want to mention today of your unsung heroes?
Well, one, especially one that is very near and dear to my heart, is Deb Spencer. She's head of the ER at Henry Ford West Bloomfield Hospital and has had to wear a lot of different hats. And I can't even imagine the amount of emotional and physical exhaustion that she's had to kind of plow through to get the job done and manage, the staff and people coming in. And it's a Herculean task that she's accomplished. Plus she has this fabulous attitude. She's always positive, and I just, talk about someone that works in a critical care. She has critical thinking, which I love. I applaud her. I cannot begin to thank her enough. Our community owes her a great deal of debt of gratitude. And if there's anything positive out of all of this, is that it does seem like people are a little more, grateful, and they're willing to show more appreciation.
Well,
So-
I totally like to reinforce what you just said about her and all the other unsung heroes you've recognized. I know a lot of other communities are doing very similar things, but it's great to see that you have that program, and that's happening right here in West Bloomfield. And by just an amazing stroke of coincidence, Deborah Spencer is standing by. We're going to get to her in a couple of minutes, and we'll find out her story and see what's going on at Henry Ford Hospital, West Bloomfield. Suzanne, thank you for joining us. Anything else you want to add today?
Just thank you again for this great job of informing the public about all these issues. And I know that I've gotten a lot of great feedback, and people actually love hearing from our local business owners to see, maybe there's some new idea that they haven't thought of to, help support their business. So thank you again for all you do.
Well, it is our complete pleasure, and it's really good to have you with us each and every day. And any other stories that you have, let us know. We'll be glad to share them. Suzanne Levine, she is the Executive Director of the Greater West Bloomfield Chamber. We're going to be right back. Stand by. We're going to check in with Deborah Spencer in just a moment. This is the Megacast.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Welcome back. This is the Megacast, and the Megacast, of course, is a radio broadcast, a television broadcast, a online broadcast. It's all of the above. Today we are live on the Chamber, the West Bloomfield Chamber's Facebook page. We thank them. We're live on Civic Center TV, Channel 15, West Bloomfield, Kegel Harbor, Sylvan Lake, Orchard Lake. We're live on BAMA, that is Birmingham area, Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and Franklin, and on 3 amazing radio stations, 89.3 Lakes FM, 88.1 WBFH the 5th, WAHS 89.5 Avondale Community Radio. But these radio stations all have some great music to play during the lunchtime hour. So we got to get right back to business. And here she is, the aforementioned Director of Clinical Operations at Henry Ford West Bloomfield Hospital, Deborah Spencer, who also is just recognized by the Chamber as their, I'm just trying to find it. Here it is. Hold on. It is. You are their unsung hero. Congratulations.
Well, thank you, Dave. It's really an honor, and I'm humbled by that nomination. But I must say that there is a hospital full of unsung heroes here at Henry Ford West Bloomfield. And, you know, my success is incumbent on their success. It's just been a teamwork. It's just not the frontline staff. It's our environmental people. It's our transporters, our lab, our facilities, our supply chain, pharmacy, lab. There's just so many people that have come together in an exceedingly challenging time to really take care of the patients that we serve and to take care of each other. And I'm just so thankful for them. So,
Deborah Spencer joining us, Director of Clinical Operations, Henry Ford Hospital, West Bloomfield. We are so glad to have you here. Thank you for your effort, and please extend our greetings and well wishes to everybody. I'm sure as you woke up on some cold January morning, thinking ahead of what your spring was going to be like, you never in your wildest dreams imagined we'd be going through this. But it's here. You've confronted it. The team at Henry Ford Hospital has. And, now that we're through the worst of it, we got a long way to go. It's hardly over, but we're through at least. We understand where we're at. Is the reality of all of this set in with you and the people at Henry Ford? I mean, you folks are literally putting your lives on the line every day when you went to work.
Yes, Dave. I think it's starting to set in. I think that during the crisis, you're just sort of on, on fast forward, making decisions in the moment and really just trying to take care of the patients. So it really doesn't give you a lot of time to have, any insight into really what you're experiencing. And so, as we kind of step back from the situation and really have time to process what we've gone through, I think that, there are a variety of challenges. I mean, I think we're all going through a grieving process. I think, we're grieving those patients that we lost. We have families who are grieving patients, family members that they lost. There's kind of a grief process that really the loss of freedom. I mean, really the freedom that we took for granted. I mean, just being able to go to the store and interact with our families and, develop relationships with other people. That's really been, a significant change in all of our lives. And, as we move forward, there's a bit of fear, really. What does our new normal look like? There's a fear of, the financial and economic loss that, this crisis has really brought to us. So, but I think we as humans, we're just resilient. I'm optimistic that, we're going to get through this and we're going to come out of this the other side, whole. And I think that what we need to understand is as a hospital and as a community, we need to support each other. We need to utilize resources to ensure that as we move through this process, we look at the well-being of the members of our team here at the hospital, as well as the well-being of the members of our community.
Well, and I hope that gets easier as time goes on. Deborah Spencer, Director of Clinical Operations. When you're charging the front line in a war, you can't always worry about your own personal safety. But as time goes on and things get a little bit more normal, hopefully that could be a higher priority. I appreciate you saying what you just said, and for me, it resonates as someone that comes in here and has a lot of information to share every day, but I try to do it in as lighthearted and optimistic a way as possible during these times. But then I'm not, working in a hospital where people are dying every day. So I appreciate your perspective and your thoughts, and it all hits home. Things are getting better, though. We are seeing improvement, and it literally, this could have been a bigger mess than it was. We are preparing for sending 1,000 patients to TCF and maybe another 1,000 patients out to Novi. I didn't have to do that. Did we ever get to a point at Henry Ford Hospital, West Bloomfield, where there were no beds available?
We did have periods of time where we were at capacity, but I must say that we had a plan. And so we were able to transfer patients that needed to be transferred in a very safe and timely manner. This is part of emergency preparedness. And, many of us have trained even at Homeland Security for situations like this, pandemics, epidemics. And so you never think that you're really going to need to utilize it, but we were prepared. And to be very honest with you, it necessitates that you make decisions very quickly and in a timely manner. And so we have a great team here, from our executive leadership team to our overall hospital leadership team to our emergency department leadership team. And so very quickly we made decisions and put some proactive plans in place so we could appropriately care for our patients while keeping our staff safe.
Deborah Spencer is with us. She is the Director of Clinical Operations, Henry Ford Hospital, West Bloomfield. I know you got new therapeutics now. That's got to be helping a little bit. But the thing that amazed me the most, and I hear this from the national news, but I really would love to hear it from you, because that's what this show is all about, because we find out all kinds of things that we didn't know when we talk to people on the front lines like yourself. But what we're hearing, that you're learning how to do this better in the ERs, in all across the hospital, in the intensive care rooms, that you're learning procedures and processes that are helping to save lives. Have you learned a lot through this whole thing?
We have learned a lot, and I think we'll take those lessons learned. So if we are ever faced with a crisis like this again, that we again take those lessons learned, and we have processes in place that are more of a proactive approach rather than looking at them from a crisis approach, so we can maybe navigate this a little easier. I don't know if it's ever going to be a completely controlled situation, but it's really exacting control when you're in the midst of chaos. And I must say we did that well. And I walked through the units, and I honestly, from top to bottom of this hospital, was completely amazed at the teamwork and how people just stepped up to the plate, and they just did phenomenal and amazing things. And for that, I'll be forever grateful. Unless you've walked this, people can't understand. But again, you just saw heroes emerge every day. And sometimes those heroes emerged in places that you never expected them to emerge. And so, again, even though this was a very difficult situation, I'm coming through this with a new appreciation of, I just don't take things for granted. I don't take people for granted, and take your freedoms for granted, and just the little things that that just make such a positive influence in our lives on a daily basis that we really need to embrace. I mean, even our community here in West Bloomfield, you know, one day they pulled all their cars up and they cheered and honked and clapped for the staff coming in. You know, it sounds like a small thing, but it brought our staff to tears. And it just, things like that, the food, it just makes a difference, that those random acts of kindness. I just want you all to know that they did not go unnoticed, and they meant a lot to us.
Well, I appreciate you saying that, and you know that would nobody had to twist anyone's arms to get folks out at the hospital. There are people, everyone knows exactly what. I mean, we don't know the details, but we understand the contribution being made behind the walls, and thank you for also recognizing the first responders who are doing a really good job and all the other people.
Awesome.
So I see a day, Deborah Spencer, Director of Clinical Operations at Henry Ford Hospital, West Bloomfield, when we will be back in your parking lot like we were last fall with the tents and the dancing and the music and the fun. And this will be in the rearview mirror. We'll be able to celebrate the victories and mourn the losses and get back to our new normal, and things will be great again. It was so wonderful being out at the hospital last fall and being able to celebrate what a great facility you guys were. And that was a wonderful celebration. But listen, the last couple of months, if anyone wasn't clear about the contribution of your facility, and it's not just yours, it's every hospital around our country and around our county and our state, we are all clear. So a big, massive, collective thank you, and a thank you to Deborah Spencer for everything you do to keep things rocking and rolling over there at Henry Ford.
Thanks, Dave. And I want you to know that Henry Ford is here for our community. And so we have, if you need any care, please come to us. We've got screening processes in place to ensure the safety of our patients and families and our employees. And we are open for business.
Well, we understand that, and people are concerned. I'm glad you mentioned that. People are a little bit concerned. They're thinking in their back of their, well, I got to get this procedure, and now it's time we can get some of these elective procedures probably done. And am I going to go to Henry Ford and get COVID? You got it under control. I know. Yeah, I know you do, and I'm really glad you took an opportunity to remind people, and we're doing the same thing every day, because I know you guys got to get back on your financial footing as well, too, and part of that is getting involved and getting all the other treatments that you have historically done back on track. So that will happen as well. Thank you, Deborah. Good to talk to you today. I appreciate your time.
Thanks, Dave. You take care now.
All right. What an amazing story of great heroism going on at that hospital and every other hospital all across our region. So that is the update on the coronavirus as we stand today. Next couple of days, Erica Jones, pull up to your microphone there, going to be big. We don't want to make a big deal out of it, but tomorrow there's going to be a big protest up in Lansing. It'll get reported, so we'll of course keep an eye on that. But Friday on the program, there's going to be a court case, and the court is going to look at whether or not the governor can continue to issue these executive orders. It won't be decided on Friday, but the hearings are going to begin, so we're going to cover that live. And I know you and Tyler will be here keeping an eye on it, taking notes. And have you ever been a court reporter in your journalistic days?
No, I never have been, but it's definitely something that I want to do. I've shadowed people before who have been court reporters, and my dad's actually an attorney, so I've sat in before. But
right, this is going to be a natural for you. Yeah. So keep an eye on what's going on Friday and share that and take notes. And we'll see you back here on Monday. I'm going to be out the next couple of days, but these guys will keep you up to date on everything that's going on. So again, tomorrow we got a full lineup of great guests and a lot of terrific local information. And then on Friday, this wall-to-wall comprehensive coverage of this case that is going to get down to the constitutional powers here in the state of Michigan, the division of powers between the legislature and the governor's office. The court's right in the middle of it, and it's government 101 at its best happening right here. So we thought you would want to be there, hear every moment of it, and experience it live. We'll have it live wall-to-wall on our Civic Center TV and Lakes FM broadcast outlets, and we'll do the very best we can to make sure that happens on all of our outlets. So thank you very much for being a part of the program today. Thanks to all of our incredible guests, Rob Fowler, Dr. Taweel, of course, Jeremy Brown from Oakland County, Suzanne Levine, and our hero of the day, Deborah Spencer from Henry Ford Hospital, West Bloomfield. Thank you very much for joining us here on the broadcast, and the Megacast will be here tomorrow live on all of these radio stations beginning at 10 o'clock. So thank you very much for tuning in. This has been the Megacast for Wednesday.